Yesterday, I made a video about a testimonial from another happy intensivcarehotline.com customer. And today I've got the same. We're having testimonials pouring in from our clients. So from our clients, my name is Patrick Hutzel from intensivcarehotline.com. And I've got another quick tip for families in intensive care. So we've got another testimonial from a very happy client, and I want to read out the testimonial. And here it is. Appreciation to you for all the work that you've done with me during my sister's illness in intensive care. She is now recovering beautifully. She's doing physical therapy and speech and is doing very well with all of them. Thank you for everything that you did when you were guiding me through this terrible experience while my sister was in intensive care. This is actually a client we worked with at the end of 2023, early 2024. She was one of our members, Giuseppe. And Giuseppe, thank you for your lovely feedback. I just want to read out what the situation was initially so you can actually understand from what conditions patients can come back from. So the original situation was that Giuseppe described in an email, but then obviously we had many phone calls and other emails. We were reviewing medical records. I'll just read that out. Hi, Patrick. My sister had a tracheostomy on the 30th of November while still in an induced coma. Now the doctors are asking for her to get a PEG tube. They are saying that she has a severe brain injury and will need long-term care. But yesterday, she was able to go 4.5 hours on PEEP and a spontaneous breathing trial. She opened her eyes for 30 minutes today, but was not able to breathe on her own today. So I don't know what questions to ask them. Please help me with questions to keep them off my back. Thanks. I look forward to hearing from you. So initially, we set her up with the right questions to ask, which is obviously very, very important. Similar to most other clients in those situations, she had the doom and gloom talk from the intensive care team, the negativity talk saying, she will need long-term care, she will never recover. And here we go, a year later, she is recovering, and that is amazing. And this feedback is so important for us and for anyone watching this, that there's hope. Like I always say, hope is not a strategy. You need more than hope. You need proven strategies, and you need to know what questions to ask. You need to know how to hold intensive care teams accountable. And that is what we are specialized in. I read out another email from Giuseppe at the time where she says, my sister is starting to open her eyes, but is not responding to commands yet. We are praying and faithful that she will get better day by day. And I'm waiting for the medical records. Then we got access to the medical records and we reviewed them. What is so important when we review medical records is, what the intensive care team is telling you, you need to verify. And you can only really verify that what the intensive care team is telling you is accurate when looking at medical records. You need to look at what they're telling you is actually documented and what are they doing actually, because most of the time what we're finding is intensive care teams are not even telling you half of what's going on. They assume that you don't understand. Well, you do understand with professional help. You do understand if you have someone on your team, like intensivcarehotline.com, we understand intensive care inside out. We can guide you step by step. If you don't have a professional on your side with a second opinion, no one will guide you step by step. And here is some of the things that have happened. Here's the diagnosis, for example, from the medical records. Follow-up for necrotizing cerebritis secondary to toxoplasmosis, encephalopathy, post-EVD placement, which was followed by left decompressive hemicraniectomy for cerebral edema. EVD has been placed, right? Patient was seen, evaluated, and unrousable. So it was a really critical situation there. And then the medical record review continues. We have had extensive discussions with the family about the grim prognosis. The family would like to continue aggressive treatment. Can you see what I'm saying? The doom and gloom, you can most of the time ignore. You almost need to ignore because you know what's going to happen if you're giving up. This family didn't give up. And look at what the outcome has been. So then the medical records from the doctors continue. Patient has been seen previously by the neurology team due to concern for seizures and had been started on Keppra 750 milligrams twice a day. She has had a complicated hospitalization since admission and continues to be lethargic. Therefore, neurology was once again requested by the primary team as well as family since she's on Keppra. Her lethargy is unlikely associated with the current Keppra dose. This was explained to the family in detail, but the family continued to be adamant on decreasing the dose to see if she perks up. Other than Keppra, she has also been getting clonazepam, which is likely contributing more to her lethargy than the anti-seizure medications. Recommendations: we will decrease Keppra to 500 milligrams twice daily from 750 milligrams twice daily, since the sister was adamant after explaining the risk, benefit, or recurrent seizures. And this was, all the while our client sister was ventilated with a tracheostomy. So this is what happens when you don't give up. This is what happens when you don't buy into the doom and gloom. This is what happens when you get step-by-step advice, when we review medical records or we talk to doctors and nurses directly, and we guide our clients what questions to ask. For example, this family would have never known that reducing Keppra might have helped, to wake the sister up. So that comes from us explaining things to our clients and taking them through things step by step. So thank you, Giuseppe, for the feedback. And once again, I hope this is hope for everyone that watches this and has a family member in intensive care critically ill, that there's always things you can control. Focus on the things that you can control, not on the things that you can't control. What you can't control is the doom and gloom and the negativity of intensive care teams. What you can control is you can ignore it, and you can start thinking for yourself and get advice and make your own judgment, make your own decisions, and put the pressure back on intensive care teams and get results. Right? If you look at our testimonial section, there's plenty of clients saying, how we helped them. We saved some lives, and you can also look up our intensivecarehotline.com podcast section where we've interviewed clients who verify the results we're getting for them. I've worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very confidently say that we have saved many lives for our clients in intensive care. And you can, verify that once again in this video today. You can also verify it on our intensivecarehotline.com podcast section. And that's why we help hundreds and hundreds of members and clients over the years to improve their lives instantly, save their loved ones' lives. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply can't afford to get wrong. And this is my case in point once again today. If this family had gotten it wrong and didn't get advice, their sister would have potentially passed away or would have not recovered to such a good point than Giuseppe is now describing. I also talk to doctors and nurses directly. And when I talk to doctors and nurses directly, I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. And I hold them to account. And I also have you on the phone so you can ask, so you can see what I'm asking, and you can see how they're responding. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get that second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. And we also have a membership for families of critically ill patients in intensive care. You can become a member if you go to intensivecarehotline.com, click on the membership link, or go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. They are only accessible to our members, and everything will help you to make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And if you like, and all of that you get at intensivecarehotline.com, call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell. Comment below what you want to see next, what questions and insights you have. Share the video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you are a subscriber to my YouTube channel or if you are a subscriber to my intensivecarehotline.com email newsletter. And all of that you get at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.